Morning, everybody, and welcome to this morning's webinar. Before we get started, I'd like for us to take an opportunity to take a poll. So I'm going to launch a poll and ask that you select an answer answering the question.
Good morning, everyone. Thank you for attending this morning. I'm going to give you some information, and I also want to talk to you about some pretty serious issues that we have going on at Emerge. Thank you first for participating in the poll at the beginning. That poll said people that are moral staff are really concerned about having high standards and following the rules. 100% of the people who responded said that they are moral staff. And I have absolutely no doubt that every person here absolutely intends to be as moral as they can possibly be. So with that, let's keep moving forward. And I'm going to now switch over to my screen. So moral, concern with the principles of right and wrong behavior and high principles for proper conduct. So thank you for the 100% of people that have said this. So what does this mean? Becomes our next question. This is a chart for COVID-19. And if someone became contagious, and several staff at Emerge have been contagious and did not know it, they were asymptomatic, they had no way of knowing that they were contagious, so they're coming to work without realizing that they could give this illness to someone else. At the top, if you have a staff person who is a carrier, who is asymptomatic, has no mask on, even if the customer has a mask on, there is a 75% probability that you are going to give COVID-19 to that customer as well as everyone else. If you're asymptomatic, or obviously if you're symptomatic, and you are a COVID carrier with your mask on, but the persons that you're around don't wear a mask, it actually drops from 75% to 5%, and that's still not good, but there is a very low risk if you are wearing a mask that you will give COVID-19 to someone else. If everyone is wearing a mask, if the person who doesn't know they have COVID-19 wears a mask, and if the customers and other staff are wearing a mask, the probability of transmission is only 1.5%. It is very, very low. So I want you to think carefully about that. Why do we want you to wear masks? Because 3 out of 4 times, if you don't wear a mask and you're asymptomatic, you are going to give this illness to someone else. So you start out with a poll. 100% of you want to have proper conduct. Well, if you want to have proper conduct, we need to define it for you. And this is the definition. First of all, in the state of Maryland, individuals with disabilities that contract COVID-19 have a death rate that right now is just about a 1 in 10 chance. It is way higher than people without disabilities. If a staff person gets COVID-19 in Maryland, your chances are probably 1 in 100 or less that you will actually die. You can be really sick, but you won't die. But this is the actual data of people served by DDA. Their chance is about 1 in 10. So if you are a moral staff person and you want to do proper conduct, first you need to recognize the risk. And the second piece, you must recognize that you are the greatest risk factor for customers acquiring COVID-19. You aren't doing it on purpose. We don't have anyone who's evil and comes to Emerge and says, I'm going to give COVID-19 to someone else. Absolutely not. But it is your responsibility to do everything within your power to make sure that you do not give this out. Moral staff will not come to work if they are positive for COVID-19. Moral staff wear masks at all times inside a building at work and outside when in a group. Moral staff maintain social distancing of at least 6 feet unless you are providing personal assistance. Masks and other personal protective equipment are always worn when providing personal assistance. They always are worn. Staff do not engage in high-risk behavior that may result in COVID-19 transmission. When you are on your own time, I want to be clear. that we have an unacceptable level of people at Emerge who are getting sick. Our customers are getting sick from COVID-19. They are getting ill. They are potentially at risk of dying. And we have to do more to prevent that from happening. And part of that, frankly, is you've got to take a look at yourself. Are you willing to say, I will not be around people without wearing masks? If you listen to Governor Hogan on Wednesday, the most common way this week that COVID-19 is transmitted in the state of Maryland is from people at family gatherings. Bars and other areas of high population density, we already know are problems. Florida right now has out of control COVID-19. If you're in Florida, your chances are way higher of dying than they are in Maryland. In Maryland, though, what's our biggest problem? Actually, people going to family gatherings, and people have forgotten. They have forgotten that this disease is there and it can kill you. And there are people are not wearing masks at family gatherings. They're not maintaining social distancing. Moral staff have got to make a decision that you just aren't going to be part of congregating in groups of 10. These are the things that you need to do. You need to inform management before you come to work if you have any body temperature of 100 degrees or greater. And if you start to develop something at work, you time out right there. You stop, okay, and you need to let your manager know immediately. If you have a cough, if you have shortness of breath or difficulty breathing, if you have been tired, if you have muscles or body aches, a headache, you're going to let management know. If you have a new loss of taste or smell, not something that's always been there, something new. If you have a sore throat, congestion or runny nose, nausea or vomiting and diarrhea, you are going to inform management. A lot of the people on this call are doing this. They have been doing this. Okay. They are doing everything I have said today, but we need all staff at Emerge to be able to do this. Moral staff will inform management in advance if they plan to leave the state of Maryland so that we may work with you to figure out if when you return, do we need to take precautions or not? This is our expectation that staff, if you are going to leave the state, and by the state, I need this immediate area. I am not discussing and am not concerned about Northern Virginia, the DC suburbs. If people live in Southern Pennsylvania, don't need to know that. Those are all part of the metropolitan area. But if you are going to leave outside the metropolitan area, which is in the state of Maryland, tell us in advance. Let us work with you so that we know, all of us, that we can all be moral staff who are going to do everything we can to limit the chances of exposure for the customers of Emerge. If you become ill, let us know. Okay? All of you who are doing that, thank you. But those who aren't have got to be able to step up to the plate. A lot of you will remember when we talked about culture at Emerge, one of my first remarks was that when you have a culture is not about any one person or any one place. The culture of Emerge is determined by everyone at Emerge. And whether or not we are going to be able to successfully do everything in our power to make sure that the people at Emerge are not being exposed to COVID-19 is going to depend upon every person on this call helping me create the culture. That we are moral staff, that we will follow those guidelines, that yes, we want to have a life, we want to celebrate, but we're going to do it in a safe way so that we do not provide risks to people whose chances in dying are 1 in 10. That's way too high. We cannot take that chance. We all have to keep on moving. We all have to keep on living. So now we need to go to another piece of information that you need. We are going to begin a reopening of our day and employment programs. And we have laid out what we will do. And I will begin and end by telling you that this is a living document, that it depends upon what happens within eMERGE. It depends upon what is happening within the state of Maryland. For the past several weeks, the state of Maryland has had rising rates of COVID-19. But people are starting to step up to the plate, and we have to project out. And right now, if people continue to do the right thing, in about a month, 3 to 4 weeks, the rates are going to go back down because people just got a little bit too careless or thought, oh, it's over. No, it's not over. It's not going to be over for quite a while. So we are going to try to reopen the day programs, and these are the things that we will be requiring. As we reopen our buildings, all staff and customers need to have a COVID-19 negative test result before starting back in a day or employment program. And if we need to help you get a test, we'll help every customer get a test. We will go to people's homes and help transport. We will give you references. We will make sure that you know where all the locations are, but all staff and customers will need to test negative. We have several people that come to our day programs that live in their family homes. And if they are not comfortable in returning, we will be offering virtual services where customers can stay in their home and they can tune in by either GoToMeeting, Zoom, or in some other way, and can get virtual services. When we reopen our buildings, we will be limiting our group size. Group sizes will be from 1 to 4, no more than 4 for day program and no more than 6 for employment services in any one group. Part of the key to us being able to open our day program successfully is that we will limit the number of individuals with disabilities in each group, but we'll also limit groups so that people are only around a few people. So people are already assigned to groups, and when customers return, they'll only be in the group in which they participate. That will be from the time that they walk out the front door of where they live to the time they get back to that place. We will redo our transportation so that people don't ride on vans with people other than people that will be in the group that they're in. Some people will be picked up by staff at home. But this will be part of what we will do in order to be successful in our reopening. Every time any person comes into our day program, they will be screened before they get on transportation or before they walk through the door of the building. So they will be screened at the point of contact with eMERGE. We will do a temperature check. We will verify that customers do not have any of the symptoms that we just listed for staff. And we will be verifying that there have not been any potential exposure. Staff are required to wear masks at all times. As we reopen our day programs, staff are required to wear masks at all times. There are not exceptions. Customers that are able to do so will wear masks, and staff will be working with all customers currently unable to be able to get them to tolerate a mask. And several staff who are working with people in their homes have already been doing a great job of making this happen. So we will continue this. It will be a guideline and requirement that unless personal assistance is necessary, staff will be 6 feet away from customers, and staff will be making sure that customers are 6 feet from each other. We will have a documented schedule for each group, and in general, each group will spend a half of a day in the building doing activities and a half of the day doing things outside the eMERGE building, whether that is outside in the park, whether they are going to a location where they can safely do other things, depending upon the time of day, and still socially distance and wear a mask, but that will be the general guideline. We will have visual markers in all of our buildings to help guide this and to provide assistance to customers so that customers know how far apart they need to be, when and where. We will limit our buildings to no more than 50% of capacity. In each building, in rooms of less than 400 square feet, there may be no more than one group in that room. If a room is larger than 400 square feet, there can be two groups, no more, but there must be at least 20 feet of distance between the groups. We will do cleaning. We will clean every surface that is coming into contact with a person using a disinfecting solution after each use by a group. So if we have a group that's there in the morning in the building, and then they're not going to be there in the afternoon, but another group's going to come in, we will clean and disinfect before the other group comes in. If a group goes to use the restroom, we will clean all the contact areas in the restroom before another group goes. This will include transportation. When people ride a van, the van will be disinfected before anyone else gets on that van again. We will manage restroom facilities so that there is no more than one group in a restroom at a time. It will be a requirement for instructors, which is consistent with what we said for moral staff, that if you're on your own time, if you go out and you get in a group of more than 10 people, where people were not 6 feet apart and weren't all wearing masks, if you go outside of Maryland, or if you got exposed, and that can happen very easily, you can be doing everything right. You could be in the checkout line at the grocery store and turn around and someone behind you coughs and they got way too close and you didn't know it. Well, that's potential exposure. Okay, so, and we will need staff to tell us, hey, was at the grocery store last night, I had a potential exposure, or I know I shouldn't have done it, but I went out to the bar, I was there with 20 people, they weren't wearing a mask. You know, I'm sorry. Okay, well, tell us so that we can work with you, because what we want to make sure of is that none of us give COVID-19 to the customers of eMERGE. If a customer or staff person has a positive COVID-19 test, or they're symptomatic, or they work after an exposure so that they've created an exposure at eMERGE, we will let everyone that they were around know, and the person, anyone who's exposed, will have to self-quarantine for 10 days. This is a change. This change is from 14 to 10 because this is now the recommendation of CDC. As people have learned more about the coronavirus, they have realized that if you're going to become positive, you will do it within 10 days. So if you become symptomatic, you have to be out at least 10 days, but you also have to be 3 days of symptom free. So if at the end of 10 days, you still had symptoms, you can't come back. You could go out to 14 days. There are a few people that can go out to 20, 21 days, and then we will work with that person to go to the doctor, because there are a few people that just keep having symptoms even when they're not contagious. But that has to be a determination made by a doctor. Any group that has an exposure will be suspended from in-program activities for 10 days. We're going to phase in the opening of our day program. Before any program opens, all the staff that will be in that program will be freed up for a day of specific training to go over everything that I have talked about, to go over additional training, training on schedules, training on what to do about COVID-19, training on how we make all this work the way that we have said that it will work. And this is our schedule. The first area that we are going to reopen is the eMERGE Horticultural Program. Okay. And we will only have 2 groups in that program, and they will start unless the governor of Maryland changes something between now and then, they will start on August the 10th. So we will do that for 7 days, that we work with 2 groups to make sure that everything is going okay. And provided we don't have problems, then after another 7 days, we will bring on the other 3 groups that will be at the eMERGE horticultural program or greenhouse. The next area that we're going to open after that is going to be the day programs at Columbia Gateway and Owings Mills. Their reopening will start on August 13th. And for each program, they will only have 2 groups in the building for the first 7 days. And if we have no problems in either building, then the buildings will move to the second phase and we will phase in additional groups. One building, if they had a problem, we would put on hold. The other building could open. The final place that we will reopen will be Sulphur Spring. The first phase will be 2 groups for 7 days, and that will begin on August 20th. And then after 7 days of no problems, the remaining groups will be in attendance. But this is a living document. This is a document that will change if we learn more about the science of COVID-19, if the Centers for Disease Control changes their guidelines, or if the direction from the governor of Maryland changes. We constantly look at these things, and we are looking at how we can provide the services that we need to provide, but also do this in a safe manner. And I want you to go back and think again. Cleaning is important, but the way that we will prevent the transmission of COVID-19 is through wearing protective equipment, especially masks, okay, and social distancing. So I want to remind you that even if you don't know you're a carrier and you're asymptomatic and you aren't wearing a mask, the chances are 3 out of 4 that you are going to give that disease to someone else. Do you really want to do that? It is only 5% if you wear a mask, even if other people aren't doing the right thing. And if everyone is doing the right thing, the chances are really low. It's only a 1.5% probability. That's a really low probability that anyone will get sick. So I ask that you think about that very seriously. I now want to switch gears. We're trying to work with hospitals. We have some more people in hospitals. And I want to go over our policy, which codifies practices that we've been doing for a long time. You will get immediately after this webinar copies of everything that I'm going over in the webinar, and it will be sent to every employee's eMERGE email. So first thing is that we will be following both regulations that are federal from CMS and from the Maryland Department of Health. This is a copy of the policy you'll receive. There are 2 things that I have underlined on this policy because these are things that are required in the law. The other things are things that are local policy. They're policies of eMERGE, and we are requesting them. We cannot tell a hospital or another long care, rehab facility or whatever, that they are required to follow this. In the majority of cases, they will, but if it's not underlined, it cannot be required. So first, we can require that some type of meeting for purposes of coordination of the plan of care be held. Because we are a Medicaid provider, hospitals and long-term care facilities are a Medicaid provider, and CMS has said you have to have a continuity of plan of care. So you have to communicate. So if a hospital calls up and says, we're discharging John at 2 o'clock and we don't have time to do any planning, the answer is, I'm sorry, it is a federal law that you plan, okay, with us, and that has to happen. The second piece is that we can require that we receive copies, either electronic or paper written, of any new treatment prior to discharge. We're requesting, and part of this is going to depend upon the discharging facility, the hospital or the long-term care facility. We're requesting 24 hours notice if they can give us that before discharge. But I will tell you that if a physician says a 24-hour notice was not medically indicated, this person no longer needs the level of care that we provide, and that just happened 12 hours ago, and in my professional judgment, it is okay to discharge, we cannot prevail. That is the right of the licensed healthcare practitioner. We are requesting that we have a discharge summary that includes all the diagnosis and new written orders that include all the medications that the person came in on. Many physicians will be happy to write those. Some will not, because they are not an expert in that area, and they cannot be required to write orders for a medication that was originally prescribed by another licensed healthcare practitioner. We're requesting copies of lab work and diagnostic tests at the time of discharge. Some hospitals or long-term facilities may tell you that their policy is that that will be sent after discharge. And if that is the case, then that we cannot prevail. If any physician is prescribing a change in status, like I want someone to be at home for 2 weeks, I want this person to be on a new exercise regimen, we're requesting that they put that in writing with the discharge paperwork. We're requesting, and this applies both to the staff of eMERGE to follow these guidelines as well as any hospital, that we will get documents by 1 o'clock, either written documents or any electronic transmission that is HIPAA compliant. Some hospitals are very sophisticated. They will have methodologies that we don't have. If it is HIPAA compliant, they absolutely can use their own procedures. We are requesting that patient discharge should occur on or before 4 p.m. And we are requesting that discharges not happen on weekends or holidays. Now, I'm talking to everyone online because this is really about a partnership. If someone goes into a hospital, frequently a team manager may be the point of contact. As I say, you will get a signed copy of this policy very shortly. And if someone that you provide services to goes in the hospital, if you can, we want you to send copies of this to 2 different places within the hospital. Send a copy to whoever is in charge of discharge planning at the hospital. That may be the social work department. Some hospitals have a specific discharge planning department, but whoever manages discharges, give them a copy of this at the time that our customer is admitted so that they know what we're requesting. And if you say, please do this if you can, you'll find that you get a lot more compliance. The other person that needs to get this is a copy of whoever is the case manager for healthcare, and that is usually the nurse in the unit where the individual is hospitalized, or the nurse in charge of the unit in the rehab facility. Sometimes this is a transmission of this policy from the nurse at eMERGE to the nurse at the hospital. Sometimes it is the team manager that will make that contact. Either way is fine, but try to get a copy of this both to the discharge planners at the hospital and to the nurse. Because in particular, if the case manager on the floor, the nurse case manager, knows what we're requesting, they will typically be great about getting this together and having it available so that we have what we need. And this will help make sure that the customers that we are working with are getting the coordination that they need, that we all understand what the findings were in the hospital, and that we are all working together. So this is a policy. We're asking that you follow it to the degree that you can. Please feel free to reach out to your manager anytime that you are a bit confused. So that is the information that we needed to transmit this morning. If you have not been doing so and you have questions, please begin to write your questions in the chat box to the right, or the question box, depending upon how it shows up on your screen. And Mr. Jones will give me those questions as we move forward. While you are doing that, I have a couple of comments. If you are a team manager, it is your job for any staff who are not on this call today to make sure that they know about this call, that they know what was on it, and you need to make sure that they know what we are requesting that every moral staff person at Emerge do. Because if people don't know, they can't do it. So part of your job is absolutely to be able to talk to the people that you provide services to. Some other things I've been requested to address by questions I've already received are, if you go out of state, do we need to know where you're going and when? We do, but we're not trying to pry into your personal information. You don't need to tell us names of people that you were with. We don't want to get into your personal business. That will redirect. But we need to know if you went to Miami and you were on Miami Beach and there were 100 people around you that didn't have masks on and they kept running up and running next to you. You don't need to tell us why you went to Miami Beach. That's your personal business. We get that. We wish you hadn't gone. I wish you hadn't gone because you may get coronavirus and you can die. Just like your chances are a lot lower, but you can do it. I wish you wouldn't, but we're not here to pry, but we are here to make sure customers are safe. Customers absolutely may not be transported by staff at this time outside the state of Maryland, other than the metropolitan area. I'm sorry, we're not going to be taking people to beaches at this time. We are not going to be taking people into high traffic areas. That is not to happen. Okay. Testing. Okay. Test in the state of Maryland. The governor has promised that if you go to a state testing facility, and these are usually the ones that are at the place car inspection stations, that he can get the turnaround on time on the test for 2 to 4 days at the outside. He is promising pretty fast, usually 1-day turnaround. Yeah, a number of you have already been tested because you've already been trying to do everything you can. And some of you, and by the way, that includes me, went to CVS and you waited 6 days, 7 days, 8 days, 10 days for your test. That's a national problem because CVS is a national chain and there's not enough testing equipment nationally, so they're stuck. The governor can't do anything about that. But for the state labs, he has everything in place. If we put you on paid leave because you had an inadvertent exposure to symptoms, okay, then that is for all the work that you would normally do. But it does not include if you've been filling in a house here and a house there. If your regular job, long-term, is 2 different positions, then we will be keeping your salary level for those 2 positions, but we won't cover places that you just drop in on. Okay? I want to reiterate, the policy is not changed, that at this time we cannot have visitors in homes. Family members absolutely can visit with people outside the home. People may go to the family homes for a visit. We're requesting that the family be tested negative, and most families already have. And if there would be an exposure, because that can happen to anyone, anywhere, that they notify us. But families, we're asking the visits to be outside the home. I want staff to be as cooperative as you can be in arranging these visits. And at the first time that the guidance that we receive says it is okay for people to visit in the home, we will start to do that as safely as we can. Now, mask procedure. I actually managed to get out of the office and out from behind all the extra paperwork that we've got going on. I did some pop-ups in homes, looking at various things. In the homes I went to, in some of the homes, staff are clearly wearing masks all the time. In other homes, you're not. You are being too loose in wearing masks. If you, with our permission, and this absolutely is happening, if you have your kid with you in a home, your kid needs to wear a mask. It's about the amount of the virus that can be in the air in an enclosed area. Masks are only being asked if you're outside because the air moves. It blows the virus away unless you're closer than 6 feet. The risk is extremely low. But the more people that are breathing air in and out in an enclosed area, the greater the viral load and the harder it will be to keep people from getting COVID-19. Why do you wear a mask? You're wearing a mask to keep the virus from coming out of your mouth into other people. But we need people across the board to wear masks. And because you're breathing all the time, you're constantly exhaling air. So please think about that. If you are working in a home and there is a COVID outbreak and you are not comfortable in working in that home, work with us. Let us know immediately so that we can follow up and we can make sure that we get staff in the home that are okay with working in that home. And if at all possible, we will find another location for you to work. If you are working with people that become hospitalized, okay, we may automatically place you in another location, or we could miss it. So contact your supervisor and say, hey, I've been working with Dave. Dave is in the hospital. I would like to continue to work. Can you please get me an alternate place to work until Dave is back out of the hospital? Because when we all communicate with each other, that is when we are going to be able to make sure that we are trying to look out for the needs of every person. Okay, at this point, I'm going to stop. I am going to check with Mr. Jones to see what, if any, questions have been placed in the chat box. Mr. Jones.
Considering that customers have been home for 5 months, behavioral issues are inevitable. Will there be any additional training on handling behaviors while practicing social distance?
We will be happy to work with you on working with people that are cooped up, that are at the end of the rope. And that's both customers and in some cases it's you as staff, because nobody likes to be cooped up. And that's okay. We will work with you on how to work with social distancing, but the reality is that part of what you may end up doing is personal assistance. We simply ask that you put a mask on if you're going to have to not maintain that social distancing. We encourage people to not hug, to not shake hands, to not do fist bumps. But there can be a time when you have to hug a person. And a lot of you work with people that every day you've got to help them get up. You've got to assist them getting dressed. You've got to assist them with personal hygiene. You can't socially distance. So please wear a mask, and please have the folks that you work with wear a mask. And don't make a mask a chore. Make it something to celebrate with the customers. That it's great that they can put a mask on, because nobody likes to wear a mask 100% of the time. And we forget. I wear a mask around my neck right now because otherwise, whenever I am away from other people, as I am now, and I am talking, I need to take my mask off. If I don't keep it around my neck, I'm going to forget. I'm going to walk out the door. I can't tell you the number of times that I have started to walk into a building and went, oop, okay, where's my mask? And I have to turn around and go back to my car because I drove to a place and forgot my mask in the car. So that happens, and that's okay, because I'm not in there breathing and expelling air. Okay, and while I'm pretty sure I'm not positive at this point, it can happen to anyone that they can become asymptomatic. Next question, please.
If a customer whom resides at a location in eMERGE and has a family member that isn't comfortable with their loved one attending the day program upon reopening, will there be measures in place to accommodate that resident?
Yes, there will. If someone is working, if someone is at eMERGE in our residential program and we're reopening our day program and people are not comfortable in going, will we put measures in place? The answer is yes. But let me be very clear with you also that right now the transmissions, not just at eMERGE, but across the entire DDA system in Maryland are occurring in the residential settings. They're not occurring in day programs. Day programs are not completely open, but they are open on a limited basis. And the problems are they're showing up in residential, and that is, a lot of that is because what people do in residential, because it's more intimate, it's closer, people are together longer periods of time, but that makes it more important in residential programs that we are practicing the use of PPE, personal protective equipment, and that we are maintaining social distancing, that we also wash our hands, that we also clean and disinfect, but that we wear a mask, that we wear PPE. If we have any concerns, wear full PPE, okay? And that we socially distance. Next question, please.
If you are not able to take a job because of work distance and haven't been contacted about a replacement, should you still be paid?
The question is, if you have not been able to take a job because of work distance, and you haven't been able to be placed, should you still be paid? No. Okay. Contact HR or ask your supervisor to contact HR. We're big enough, we're diverse enough that we will be able to work with anyone who is reasonable, and we will find a way to find a place for you. Next question, please.
The next question, do we have a plan for staff with children for the school year, being that it will start off virtually?
The question is, do we have a plan for staff with children for the school year, since the school year is going to start virtually, and that is now true of every place in this section of Maryland. So everyone in Maryland that has school-age kids. The answer is we do not have a plan at this time that is specific, but we will be supporting staff that have school-age kids. We have begun the process of asking staff if they are going to have a problem. We are looking at what all the potential options are in ways that we can help you, because some of you are going to really be in a not good place, because you got kids that they're too young to just be left alone. You don't have enough support system to watch them, and they're not going to be able to go to school. So we are going to have to find ways to work that out, and they're going to have to be individualized ways to do that. You are going to treat the customers the way we treat you. And I expect every employee of Emerge to treat customers with respect. Sometimes respect can also be calm but firm, okay, and no nonsense. Okay. Well, I want Emerge to treat staff with respect so that we set that example, but we're going to be calm but firm. Okay. And we all got to work together on this. Next question, please.
How will and are we allowed to know if another staff person is exposed?
The question that I was given was, how will you, or are you even allowed to know if another staff person was exposed? If a staff person or customer was exposed that you were around, we will tell you. The details of the exposure, we cannot disclose. I can't tell you that Dave was at Joe's bar and he was really bad, and now he's exposed. But I can tell you, you were around Dave, and on the 14th, he had an exposure, which means that you potentially have had an exposure. May not have been, because we don't know yet if Dave is someone who can transmit to other people. But we will tell you if it affects you. Emerge is big enough that we have an exposure on First Street. It has nothing to do with Fifth Street, because no customer or staff have ever been around each other. So we do not try to keep that level of communication going, but we will tell you if it affects you. We will tell all customers. We will tell all customers' families of any potential exposure.
With the customers starting to go out, is it possible for Emerge to supply the homes with additional cleaning supplies like disinfectant?
The question is, with customers starting to go out, is it possible for Emerge to supply the homes with additional cleaning supplies like disinfectant? Emerge will supply cleaning supplies to everyone. But I want to say, I want you to stop and think a minute. What is the best, the absolute best cleaning supply on the market today? I want you to think about this in your head. You can't put it as a poll. Think about it in your head. Okay. The answer is, it is bleach. It is bleach to begin with. It is bleach hands down. It is bleach till the end of the world. I just looked online. I got an advertisement for this unbelievably great cleaner yesterday, and it is only $165 a gallon. It is highly recommended. It sticks to surfaces. It is great. I looked at the label. Guess why it's fantastic? Because it has bleach in it. Okay? And in fact, that's the only thing it has in it, this disinfectant. That and great and slick marketing. So we will supply that. We will supply cleaners for people, because you can't put bleach on people. And I will remind you, though, that the safest way to clean your hands is still not alcohol cleaner. The safest way is 20 seconds of careful hand washing, okay, with soap and water if you do a good job. Alcohol is a little bit easier to use. So alcohol-based cleaners, when you rub it on, it's a little bit easier, but the actual safest and best way, okay, is with soap and water, which is why surgeons in hospitals still scrub up. They don't just spray alcohol spray on their hands. They scrub up to get everything off. If you need any kind of disinfecting cleaner at your home, then please let us know and we will get it to you. And please plan ahead. At the day programs, we've already created inventory lists so that we know we have to have a certain amount of stock so it doesn't get low enough to run out. And at your home, and put it in writing, please. Please use email if you can. Text sometimes get missed. Emails less likely to get missed. Still happens, but less likely. And let us know before you run out to make sure that we have adequate inventory in each place. Next question, please.
Next question is, how are we ensuring PPE equipment is in all houses for all staff?
The question is, how are we ensuring that PPE equipment is in all houses for all staff? There's a partnership. We keep an inventory of PPE equipment in the office. We have people available 24 hours a day, 7 days a week to bring that to houses as needed. That partnership is every person saying, I will look, if we need some more at this house, I'm going to make the call. I'm going to make sure that people know. Team managers are supposed to be keeping tabs on the supplies. And yeah, that's you're the key point people, team managers. You're the key point people when talking to the overnight awake staff to make sure that they if they were not on here today, that they know what we're saying. So that's a big job and it's an important job. And thank you, team managers. I know a lot of you are doing that. But if there's any question in your mind, if you run out on Saturday at 7 p.m., we will get it to you. Okay. Next question, please.
If there are any questions after this forum, who should we refer our questions to?
The question was, if there are any questions after this forum, who should refer the questions to? You can email them to me. You can email them to your manager. You can email them to Mr. Brent Jones. You can email them to your program director. We will answer those questions. We will be ending this webinar on time in 4 minutes, so I have time for 1 or 2 more questions. Do we have another question, Mr. Jones?
Many questions. How do we as staff working together help other staff that aren't wearing masks or have not worn masks wear the masks so that we don't have confrontations?
This is the best question of the day. How do we, when we're wearing masks, but we're around people that aren't wearing a mask, how do we help them learn to wear masks without a confrontation? And the answer is going to be different for every one of you. Those of you who know me, I would tell you that I went into my local Subway 2 weeks ago, and there was a guy in front of me. I wanted a sub. And as you know, most of you know that my wife would be in the very highest risk category that there is. And if I got coronavirus and gave it to her, the odds are really, really bad. This guy is trying to order a sub without a mask, and there were 2 young men in there who didn't seem to have the nerve to tell him, you don't do that. Believe me, he went to the car and got his mask. He hadn't had one. I always carry an extra. But I told him in no uncertain terms that he did not have the right to kill anyone other than himself. And that's exactly what he was doing. He was placing, and he has no right to give me the coronavirus to give to my wife to make her die. So he's bigger than me, didn't matter. That's not going to work all the time. What do you have to do? Well, I would ask someone to wear a mask. If they're not, then I would let my manager know. I would ask that your name be kept out of it. If you think there's going to be a confrontation, keep your name out. And if your manager is not comfortable in talking to the person about wearing a mask, we will find the person who is. And if there's no one else, Brent Jones or I will tell the person. You know, sometimes people don't get it. Sometimes people are just being careless. Sometimes people have heard different stuff. You know, they've heard that they're not okay. Well, you know, that they and when we get people to listen, we will. But if someone thinks that they are just not going to wear a mask at Emerge, then my answer is you are making a choice not to work at Emerge. And I will be happy to help you make that decision an actual action step. Sir?
Due to time constraints, sir, I see that just let people know there are other questions asked to be answered in the email.
There are a number of other questions that we have, and we will not have time to answer them all today. So I will send out an email to all the staff of Emerge with the questions and an answer to that question in written form. Thank you for your attendance today. I want you to think about how you can help make Emerge a place where the staff are moral and where our culture is a culture of moral staff. And that means our actions, not our words. Thank you. Have a good day and be safe.